The situation changed lives of many Kenyans, and Maluse Mesha compiled the journey of coronavirus in the country since the first case to date, and here is the story.
The Ministry of Health confirmed the first coronavirus case in Nairobi on the 12th March 2020, the first one in the country to be reported since the outbreak in China November 2019.
I want to inform you that the Ministry of Health has confirmed the first coronavirus case in Kenya.
The case was a Kenyan citizen who traveled back to Nairobi from United States of America via London, United Kingdom on the 5th March 2020. She was confirmed positive by the National Influenza Center Laboratory at the National Public Health Laboratories of the Ministry of Health here in Kenya. The patient was clinically stable and was managed at the Infectious Disease Unit at the Kenyatta National Hospital.
The case is a Kenyan citizen who traveled back to Nairobi, returning from the United States of America via London.
The Ministry of Health embarked on contact tracing for all persons who had been in contact with the lady. And the ministry began providing regular updates and further communication in different respective government agencies, as government, together with the Ministry of Health, continue issuing more restrictions in the country, continue recording more cases daily. Cases of coronavirus increased in the country from the month of July to November. Ministry of Health announced it as the second wave of coronavirus in the country. Are Kenyans still expecting more waves in order for them to follow protocols and guidelines? Several counties continue registering a large number of coronavirus since May and July, led by Nairobi County, Mombasa, Kilifi, and Mandera, where restriction of movement was prohibited.
Contact tracing of the recent surge of infections indicates that our socializing without regard to protective behavior, particularly in an environment serving alcohol, is becoming one of the greatest risk factors in our country.
Kenya closed up its boundaries to prevent further spread of the virus, the situation that almost led Tanzania and Kenya into diplomacy with her neighbor. Large traffic trucks were witnessed in the border, putting people at risk of contracting the virus. President Uhuru Kenyatta's monthly speeches gave Kenyan hope that in terms made Kenya to lose it again. Kenyans became tired of lockdown, forcing President to open for them, especially those who were locked up country. Closure of educational institutions in Kenya, especially in the primary and secondary schools, leading to the increase of early pregnancy of adolescent girls. Most of parents fail to take care of their children, leading to increased pregnancy during the pandemic. The situation forced Minister of Education Professor George Magoha to announce the reopening of school in phases. Despite the reopening of schools, cases continue rising, leading to several students and teachers contracting the virus countrywide. Minister of Education insisted that there will no closure of school.
There is no need for the learners to be alarmed, but as of tomorrow morning, we expect all day scholars to remain at home, both in primary and secondary school.
A long-lasting solution was found, and students began to report back to classes in phases. The spread of coronavirus continued across all learning institutions, but the Ministry of Education did not shut them down.
In the territory of the Republic of Kenya, with all movement by persons not authorized to do so, or not being medical professionals, health workers, critical and essential service providers, being prohibited between these hours.
Learning institutions in the country continue facing challenges on how the measures and restrictions given by the Minister of Health and the government, it will be adhered to. Schools will be open to all students from January 4th, 2021, as announced by the government. Until December this year, Kenya has been recording more coronavirus cases. With a lot of hopes globally of coronavirus vaccine, Kenya still has its number growing up daily. According to the Ministry of Health, Kenya is partnering with developed countries to provide vaccine in the country. According to statistics from the Ministry of Health in Kenya, since the first case reported, the nation has recorded more than 9,000 infections and over 1,000 deaths of corona-related cases and more than 78,000 recoveries. Globally, statistics of COVID-19 cases is more than 75 million. Death is more than 1.6 million and recoveries being over 52 million. WHO continues warning that even with the discovery of corona vaccine in the world is not yet at peace at the moment. People should take precautions. Indeed, 2020 has been a long year with many challenges, especially for the lower class people in the country. As we usher in New Year of 2021, we are hoping and expecting for the best. Mwaluse Meshak, Switch TV, Nairobi.